Hey guys, it's Dr. Daniel Sugai, board certified dermatologist. Welcome to my channel. Today we'll be talking about ways to upgrade your nighttime skincare routine. So I just finished clinic, busy day, love seeing my patients. I have really appreciated the patients who have found me on YouTube, TikTok, Instagram, at Dr. SPF on TikTok, at Daniel Sugai MD on YouTube and Instagram. So many of you have come into clinic and met me in person after seeing my long form videos, my short form videos. So just having a really great time producing content online that provides dermatologic education, never advice, okay? So it's all skincare, fun, education, tips, myth busting. Today's video is really nice because I'm gonna talk about how dermatologists wind down after a long day, because we wanna strive for healthier skin and not so much perfect skin. We want to embrace our wrinkles, our scars, our pores, but how can we age the way we want to? How do we help minimize scars, minimize pore size, and just help with, you know, dark spots, fine lines, and wrinkles, right? So we have all these affordable options out there. Might as well jump into it and, you know, see what works for you. You don't want to just go and buy a bunch of stuff without a clear goal in mind. So for me, in my late 30s, I'm all about hyperpigmentation because I grew up in Hawaii, lots of sun damage, and it's led to hyperpigmentation and also wrinkles because I'm a parent and I work, and there's lots of, you know, there have been a lot of sleep deprived nights because of training and residency or having kids. So, you know, there are wrinkles and I'm proud of them, you know. So let's talk about how can we really go after wrinkles, dark spots at night, and also some tips or mistakes that people make, okay? So after a long day, you wanna wash your face. That part is not negotiable, okay? You wanna wash your face with something with either salicylic acid or benzoyl peroxide. If you're not pregnant, I say it's totally fine to use those cleansers. There are dermatologists who will say it's fine if you're pregnant to use those cleansers with salicylic acid or benzoyl peroxide, but it's always traditionally been a class C where we don't have enough evidence to say if it's safe or not with pregnancy. So I just say minimize things, use just a water-based cleanser. Now, if you have makeup on or thick water-resistant sunscreen, you wanna do a double cleanse. Double cleanse means you use micellar water or an oil-based cleanser first, like say Iunik's Calendula Complete Cleansing Oil. That's one option, or use micellar water. Really work it into your makeup and break that up, and then follow up with a water-based cleanser. Say, you know, if you want a foaming action cleanser, the Toleriane Purifying Cleanser by Roche-Posay. This is known to be good for removing makeup. The CeraVe Hydrating Cream to Foam Cleanser. This one has been known to remove oil and makeup very well. That's your water-based cleanser after your oil-based cleanser or micellar water. Now, if you are like me and you want to work on your pores because you've been wearing a surgical mask while I do procedures, or I went to the gym and I worked out, I want to control any clogged pores. I don't want to have acne along my temples where my sweat collects. Or if you suffer from body acne, you want to cleanse your body with a cleanser with appropriate ingredients like salicylic acid. So I love salicylic acid because it's a beta hydroxy acid. It's lipid soluble and it goes deep into the pore. CeraVe makes a nice 2% salicylic acid, has hectorite clay to help absorb excess oil, niacinamide to regulate sebum production. Cetaphil, they also have made a nice new gentle exfoliating SA cleanser. Very nice. Another favorite of mine has been La Roche-Posay's Effaclar 2%. My only critique with this is that the cap, when you open it up, a lot of product comes out. It kind of just spills right out onto my palm, and it's maybe a little bit more cleanser than I'd like. So I always put the excess on my body and wash my body in the shower. So I leave this one in the shower, and after a workout, or if I showered and I went out, you know, I did some nightlife and I came back home, I'm not gonna just go rest my head on the pillow after brushing my teeth. I'm gonna wash my face at the sink. So I might have the pumps at the sink, and I'll have this guy who I wish wasn't a pump. I'll have him more in the shower because I'll put the excess on my body. So those are nice. The next cleanser to consider would be benzoyl peroxide. Benzoyl peroxide has been in dermatology for over 60 years in the treatment of acne. It's helped with topical antibiotics because it helps prevent bacterial resistance from forming against those topical antibiotics. So it's been nice to destroy bacteria that causes acne, helps exfoliate the skin. So I've liked benzoyl peroxide, Panoxyl, Clean and Clear. Those, you know, those brands have traditionally made benzoyl peroxide products, but also CeraVe has made a nice one, and Cetaphil, and I've talked about them in other videos. So you know, I wouldn't double up on salicylic acid and benzoyl peroxide in one day. I would separate them and do one day salicylic, the other day benzoyl peroxide. So just don't double up because you'll really run into trouble and drying out your skin too much, okay? And after you wash your face, you can pat dry with a clean towel. I'm gonna apply a retinoid. Retinoids are great, and you wanna apply them at bedtime, especially if you're on tretinoin. Tretinoin's very unstable in sunlight and even artificial light, but primarily sunlight. So I always say at night, apply your retinoid, whether it's adapalene, retinol, you want to apply it at bedtime. There are photostable forms, but I say just in case, apply it at bedtime. So there's different ones that I talk about. I've loved Skin Better Science, Alpha Ret. May loves Moonlight retinaldehyde serum. So retinaldehyde is stronger than retinol. I would say if you're not a beginner, you can try this out. If you've tolerated retinol, go for it. If you have never tried a retinol at all, go for something gentler like Olay Retinol 24 has niacinamide, peptide complex, and your retinol. So this is very gentle. Just a pea-sized amount is all you need to treat your whole face. It seems like not enough, but I promise it's enough. There's Kiehl's. They've made a nice night serum. This one packs a bigger punch than their other one that has a peptide, but this one is the fast release wrinkle reducing night serum. So this one is really nice. Olay Retinol 24 has made a nice serum. You could have one retinaldehyde, one retinol, but I would not double up on them. I would do one night retinol, the other night retinaldehyde. Retinaldehyde is stronger because it gets converted just once to become active retinoic acid, whereas retinol has to be converted twice, okay? So that's why this one is stronger than the retinol. Now, if you have acne, mild acne, clogged pores, people complain about textured skin, those little white heads on the face, adapalene over the counter is what you wanna go for, okay? This is, Differin gel, La Roche-Posay, they make adapalene 0.1%, which is over the counter in the US. And again, just a pea-sized amount to your entire face. And I wanna see more evidence on it working on fine lines of wrinkles, collagen, like retinol and tretinoin, even Skin Better Science. They have evidence that can help with photo-age skin. And if you look at retinol and tretinoin, you can see they have evidence that it helps even with 60-plus-year-old individuals. So you're never too old to start a retinol or a retinoid, but I would not use a retinoid when you're pregnant. The oral form, isotretinoin, is teratogenic to a fetus, so it's too much vitamin A for a fetus. So I always say for the topical form, even though it's very different in terms of absorption and systemic effects, there's that theoretical risk of it not being the best for a fetus. So I say just in case, don't use it during pregnancy. Also at bedtime, if you want to work on, say, chest, your arms, crepiness in your arms, your legs, the same goes for applying a retinol body lotion or cream at bedtime. Use that for bedtime, okay? So Coco Kind's made a really nice retinol body cream. I've been loving this texture. The Verse retinol body lotion, also nice. Naturium makes it another good one. So just choose one and apply it to the areas that you're concerned about. A lot of my patients are putting it on their forearms because it's getting very thin, the skin, where they just do a little bump on the door handle or resting their arms in the shopping cart and they're gonna get bruises all over their arms. And so that's called actinic purpura, and the retinol, the vitamin A, is to help with collagen production and thicken up your skin. A little tip there for the body. Now, if you don't have that concern and you just very dry, you have dry skin on your body, I'm going to talk about some good moisturizers for your body. Eucerin Advanced Repair Cream is one of my favorite body moisturizers, so do that at bedtime. I'm from Hawaii. We shower or take our baths at bedtime, and so after your shower, you want to apply to damp skin a good moisturizer, and this one is where it's at. It has a little bit of urea, has ceramide. I just love the texture. It's not a lotion, it's thicker, it's a cream, so locks in moisture that you got from the shower. I also like Eucerin's Roughness Relief Spot Treatment for, say, really dry, thick elbows and knees. This has an extra boost of urea, so check this one out. If you have keratosis pilaris, Cetaphil has made a new 20% urea that's on the higher side of urea that really helps with keratosis pilaris in the back of your arms, your thighs, where you get those keratin plugs that are follicularly based. People call it strawberry skin. So if you want to help gently exfoliate those little plugs, use urea. Urea is a nice humectant. It really draws in water and helps exfoliate those plugs. So this is a nice one. Amlactin uses lactic acid to help exfoliate. I like that brand a lot. Costco has the best deal for that. So apply that at bedtime when your skin's slightly damp, and it's gonna help soften either the thick skin on the elbows and knees or the keratin plugs of keratosis pilaris, okay? After you apply your retinol or retinoid, you wanna moisturize. So they're different moisturizers, and I'd say that go for a moisturizer with peptides in it. If you're mid 30s and up, that's another way to boost your collagen, right? If you are just a youngin in your 20s, go for anything. CeraVe, Cetaphil, CeraVe makes a nice PM lotion. If you're on the older side, in your 30s like myself, you could splurge a little bit more on, like, say, SkinCeuticals, Kiehl's Ultra Facial Cream, my favorite moisturizer after a retinol. And then when we go back to peptides, there's First Aid Beauty. They make a nice firming cream with niacinamide and peptides. We've talked about the Inky List on the channel. We've talked about Skin Fix. We've talked about OneSkin with their proprietary OS1 peptide. Their face supplement moisturizer has been really nice, and I like that brand a lot. They're great products, great sunscreen, and great moisturizers that will help boost collagen production and clear out the cells that are just not regenerating anymore. So I think peptides is a really nice addition to your nighttime skincare routine after your retinol, because you're just gonna both work on increasing collagen and helping with those fine lines and wrinkles, improve elasticity in our face, especially if we're noticing sagging, crepiness in other areas, okay? So I like eye creams during the day with caffeine, like morning time, but you could go to sleep with a eye cream, but I'd say it's probably, for me, more important to use it during the daytime. Sometimes I'll treat myself and put a little bit of, Kiehl's avocado creamy eye treatment before going to bed. The avocado oil is very nourishing and moisturizing for this delicate area. Now, in terms of, say, dry, cracked heels or hands before you go to bed, you could really capitalize while sleeping on those areas. You just get a nice tub of Vaseline or Aquaphor, their ointment body spray. This is so convenient, right, guys? You just spray that on the heels, wear a sock, and go to sleep. When you wake up and you take the sock off, it's gonna be nice and silky smooth. So that's another nice way to upgrade your nighttime skincare routine. Also, Aquaphor is made repairing foot masks. It's just 10 minutes. You could do this before going to sleep, or you can even fall asleep with it. My MA, my medical assistant, did this overnight, and she reported back saying it worked really well. I have this little baby sample of Vaseline, so cute, right at my bedstand. I keep it separate, the lip Vaseline, just because I don't want to get it mixed up with the foot one. This one I definitely will use during the winter time when the heaters are on, drawing out all the moisture while we sleep. So I really find that petrolatum is a nice thing to put on your lips, especially if you're on, say, acne medications. Isotretinoin will really draw out your mucosa in your nose, your lips. So you can apply a little bit, just a small amount of Vaseline in the nose and on your lips before you go to bed, and stay hydrated while you're on that medication. So I think that's it, guys. This was a fun video. I love talking about upgrading your skincare routine at nighttime. In the evening, there's a lot of things we could put on our face, but don't overdo it, and always have a clear goal in mind before you go out and shop for skincare. Please hit the like button. Please share with your friends who are into skincare. Please subscribe to the channel. We'll keep talking about skincare and affordable skincare on the channel. All right, take care and peace.